My name is Alejandro González de la Valle, and I'm an orthopedic surgeon specializing in hip and knee replacements here at Hospital for Special Surgery. I typically see patients affected by bad hip and knee arthritis. Arthritis is the wear and tear of the cushioning of the joint. And when the wear is such that the majority of the cushioning or the cartilage is gone, patients develop a fair amount of pain, stiffness, and it's difficult for them to function. When I see patients for the first time, it's important to understand what they want. A lot of our young active patients want to go back to being very active, participating in sports, and it's very rewarding to see what they are able to do once their hip or knee pain is gone. The materials that we use nowadays for hip and knee replacements have improved so much, to the point that there is less wear of the mechanical parts even when our patients are being more active after the operation. I have no doubt that the improvements in the quality of the materials will result in hip replacements that will last longer than those that were done, let's say, 20, 30 years ago. The use of technology, together with other advancements in perioperative care, have allowed our patients to have shorter recovery time. The majority of our young, healthy patients actually go home the same day, and with less soft tissue and muscular damage, there is certainly better postoperative function. It's very important to get the best possible care for your first joint replacement, as we want it to last a very, very long time. In that regard, practice makes perfect, and it's on the patient's best interest to have a joint replacement by a high-volume surgeon, hopefully working in an institution that is devoted to orthopedic care. As an orthopedic surgeon, I don't act alone. We cannot forget the human factor. I work with a wonderful group of people in and outside the operating room, and I have no doubt that the results that I see in my patients are a direct consequence of teamwork rather than the actions of a single person. The majority of patients who have a hip or a knee replacement do quite well, and it's very rewarding to read emails or see photos of places they were able to visit after their hip and knee pain is gone. For me, it's a personal matter. I try to treat my patients as if they were my own family.